In this video, we will be discussing pulmonary diffusing capacity. Pulmonary diffusing capacity refers to ability of lung to transfer gases from alveoli into pulmonary capillary blood. This process depends on structural factors such as surface area and membrane thickness, as well as physiological factors like capillary blood volume and interaction with hemoglobin. Principle of gas diffusion. The gas transfer across alveolar capillary membrane follows basic diffusion principle. The rate of transfer depends on pressure gradient between alveolar gas and capillary blood, the available surface area, the thickness of membrane, and the physical properties of gas. Diffusing capacity equation. The diffusing capacity is defined as the rate of gas transfer divided by pressure difference between alveoli and the capillary blood. This equation represents how efficiently gas moves across the lung. Structural design for diffusion. The lung is optimized structurally for gas exchange. It provides a very large surface area, approximately 130 square meter, and an extremely thin diffusion barrier about 0.3 micrometer. Functional significance. Because of large surface area and thin membrane, gas transfer is extremely rapid in healthy lungs. Under resting condition, diffusion is not the limiting step for oxygen transfer. Components of diffusing capacity. There are two main resistances to gas transfer. The first is diffusion across alveolar capillary membrane, and the second is the resistance caused by reaction of gas with hemoglobin inside the capillary blood. Roten-Foster equation. Total diffusing capacity is determined by two components described by Roten-Foster equation. One part represents the membrane diffusion and other part represents reaction of gas with hemoglobin in capillary blood. Perfusion limited gas transfer. In perfusion limited gases, equilibrium between alveolar gas and capillary blood occurs rapidly. Once equilibrium is reached, further transfer depends only on blood flow. Nitrous oxide is a classical example. Diffusion limited gases. In diffusion limited gases, equilibrium does not occur across capillary membrane. The transfer remains limited by diffusion across the membrane. Carbon monoxide is classical example because it binds strongly to hemoglobin. Oxygen transfer. Oxygen normally behaves as a perfusion limited gas. It equilibrates with capillary blood early in its transit. However, in conditions such as interstitial lung disease, high altitude, heavy exercise, oxygen transfer may become diffusion limited. DLCO measurement. In clinical practice, diffusion capacity is measured using carbon monoxide. Because carbon monoxide binds strongly to hemoglobin, its capillary partial pressure remains nearly zero. This simplifies the measurement. Determinants of DLCO. DLCO is a composite measurement. It reflects not only alveolar surface area and membrane thickness, but also on capillary blood volume and hemoglobin concentration. Conditions increasing DLCO. Diffusing capacity increases in conditions that increase capillary blood volume or hemoglobin concentration. Exercise and polycythemia are typical examples. Conditions decreasing DLCO. Diffusing capacity decreases in conditions that reduce surface area, thicken the membrane, lower the hemoglobin, or reduce capillary blood volume. Common causes include emphysema, fibrosis, anemia, and pulmonary vascular disease. Clinical use of DLCO. DLCO is useful in detecting interstitial lung disease, diagnosing emphysema, assessing pulmonary vascular diseases, and evaluating patients with unexplained shortness of breath. In summary, pulmonary diffusing capacity reflects the efficiency of gas transfer from alveoli into blood. It depends on both membrane diffusion and reaction with hemoglobin. DLCO is a standard clinical measure and reflects structural and vascular integrity of lung.